Hi there. I'm preparing this video as a way to provide introduction to my humor in psychotherapy presentations. So I hope that you enjoy it and that you find it insightful. I'm going to pull up some slides that I prepared. I do like to prepare new slide deck for every presentation I do, so that I'm not just recycling the same old slides and making it a new experience for people who've maybe been to my presentations several times. So welcome to the introduction to finding the humor in psychotherapy. I'm Glenn Maloney. Glad to have the opportunity to have you watch this. Quick agenda. We're going to learn a bit about me today. I'm going to talk about humor and supervision and training. We're going to touch on humor and culture, which I think is one of the biggest things we need to focus on when we're thinking about using humor in therapy. I'm going to provide a case example, which I love to do when I do my presentations. And then I will tell you about some other topics I often present on when I present on humor. So I was told early in my career as a psychotherapist to be careful with humor. And although I got this advice a couple of times, once from a professor while I was working on my master's in social work at the College of St. Scholastica, and again with my first clinical supervisor at a community mental health center, I didn't get further guidance than that. And I wondered, like, what does it mean to be careful with humor? And I think saying be careful with humor is a great way to seem really wise, but without more substance, that's not useful for many of us. I tend to see things in a pretty straightforward manner. I like to have good guidance when I'm trying to learn something. I like my learning to be from the ground up, and I didn't feel like I was getting that. And in 2018, I questioned a humor-based intervention I used in session. You know, you do therapy and you go home at the end of the day and you think about the therapy you did that day. And I thought about this intervention I made, and it led me to really dig into this in a more concerted manner. What does using humor in therapy really look like? So since 2018, I've continued to read about this, discuss it, and present the use of humor in therapy and other human service professions. This accelerated during 2020 when we were all locked down for the pandemic. Filling my time at home, I did more and more research and started sort of some soft writing about humor, which led eventually to me publishing the book, Finding the Humor in Psychotherapy, which is a book that includes many of the things I talk about in my presentations. And I think really provides guidance for especially new therapists on how to use humor carefully and well in our sessions. Um, my most recent proudest accomplishment includes the Exemplary Leadership Award from the Minnesota Social Services Association for my work in humor, the publishing of the book. I've been featured recently in local news, both in the Duluth News Tribune, and on This Week Friday, I have a television interview with WDIO. So excited for that. I've done a lot of presentations going back to 2019. I presented one called The Humor Intervention. This was rather early in my career, and I feel like early in my career as a humorist, I suppose. And I feel like I've become much more nuanced, both as a presenter as well as in terms of the information I can present to people. I talked about humor as a self-care for educators in 2020 at a local college. I've done a presentation, Humor and Working in Co-occurring Disorders. Co-occurring disorders of mental illness and substance use are sort of my other specialty. Advanced considerations of humor in therapy. This is more related to how different theories in social work and psychotherapy can fit with humor. I did the CEU Winter Conference this year, which was a great experience. as well as the NASW, the Minnesota NASW Winter Conference, the Minnesota Social Services Association Conference, and I've presented to both the Minnesota Psychological Association as well as the Hawaii Psychological Association. This isn't an all-inclusive list. This is sort of some of the biggest ones that I've been proudest to be part of, although I am proud of course, every opportunity that comes my way. So early in 2024, when I presented at the MSSA Winter Conference, I took a survey, and my session was attended by over 500 people. I had 126 people respond to my survey. And I found that 89% of therapists have found humor useful in their careers. 56% of them have had this go poorly, and 24% have been challenged by supervisors or colleagues about the humor that they've used. So they shared an example of humor from session, and they were challenged about that by supervisors or colleagues. For those attending who had been clients, 29% had experienced humor in session negatively. 76% had found it to be helpful, and 66% think that there could have been more humor used in their psychotherapy sessions. I think looking at this data, we see many therapists, the vast majority of therapists are using humor in therapy, Over half of them have had this go poorly, but only 1 in 4 have gotten any sort of training or guidance or supervision related to how to do this well. So I think that there is a great need in this area. Meanwhile, in terms of clients, almost a third of clients in therapy have experienced humor in therapy in a negative way, while 3/4 of them have found it to be helpful, and 2/3 feel there could have been more. So clients feel there could be more. It's been helpful, but it also can go poorly, again, pointing towards the need for training in this area. I like to look at research related to humor, both in terms of psychotherapy as well as humor in other areas. There's a lot of great research on humor from other medical professions outside of psychotherapy. Some to consider. In 2013, Stephen Saltinoff did a great literature review of the literature at that time, indicating humor's robust use in therapy, also indicating need for further study, which every good study indicates, right? Husong and Michucci in 2021, they wrote an article called The Use of Humor in Psychotherapy, Reviews of Practicing Psychotherapists. In this article, they talked to 10 different practicing psychotherapists, both about their use of humor in session, as well as about how they experienced humor in session when they were clients in psychotherapy. Also in 2021, Opperman and Lindy wrote Laughter in Therapy, Seriously Important. And Sarinkin Garcia in 2023 wrote Humor Interventions in Psychotherapy and Their Effect on Levels of Depression and Anxiety in Adult Clients, a systematic review. And then sort of, less research-based, but I think equally important, I saw an article earlier this year in Psychology Today that was providing guidance to new therapists. And one of the points it made was to remember the usefulness of humor in session. And I've seen several, maybe as many as a half a dozen articles in Psychotherapy Networker over the last several years that have discussed or indicated the use of humor in session as a positive tool. Despite this acknowledgement and research, again, there continues to be little training about how to use humor well in therapy and other social services professions. Much of what I'm trying to do today, one, give you, let you see my face, give you a little taste of my presentation style, if you will, but also identify that this is a needed thing. Okay, I really think that we need more training in basic tools of therapy. We get a lot of training in really broad ideas like cognitive behavioral, internal family systems, EMDR, and etc., but not as much training is available about basic tools of human connection. I think culture is a very important part of how humor works in psychotherapy. Of course, culture is important in psychotherapy, full stop. But as I've learned more about humor's role in therapy, it's become increasingly evident that culture is super impactful here. And first, because we all learn how to be humorous and how to use humor from our cultures of origin. And one thing I reflect on here, if we come from sort of a mean culture, then we use humor in mean ways. And I think we really do see a lot of that in our culture. Humor being used mean-spiritedly, humor being used to put people down, even sarcasm, which is a type of deception, being very much a language that people use. And that's all what it is, right? But the point I'm making is that the culture establishes our approach to humor. And because our culture so frequently uses humor in mean-spirited ways, we need to be particularly careful with humor when we use it into this in the psychotherapy session or when we're otherwise serving clients in social services. Then a second important point here is different cultures use humor differently. And this is rather obvious, but I've really seen this in very real ways as I've had the pleasure of presenting about humor in therapy across the nation and around the world to different cultures. And I've been informed by other therapists practicing in other cultures what it looks like, what humor looks like in those cultures. So I talk about cultural humility, right? And we are least competent with cultures that are the most different from our own as individuals. So, I'm a perceived white male. I use he, they pronouns. And so the culture I am most competent in is the culture that I am most similar to. And as a group of people become more different from me, I become increasingly less competent in that culture without training in that culture, without consultation within that culture. And I think this is an important part of cultural humility, acknowledging that I'm less competent in some cultures than in the ones I've been raised in and entrenched. And therapists are almost only trained in the use of humor by their cultures, not clinically, because there is such a lack of training in this area. There is some limited guidance. So John Lee and Howe wrote an article that pointed out that African American men react more positively to humor than Asian American men in session. And this tells us only that we should be more careful with humor with one population than with another, but we always need to use therapeutic tools with care regardless of culture. This is especially true of humor because jokes can really go the wrong way and creating that need for more guidance. When it comes to culture, the point I make is that we should all be seeking guidance from elders and experts that reside within that culture. And I think that that's an important type of collaboration that all of us as service providers need to be doing, seeking consultation, not just from other service providers, but from elders and experts residing in the cultures we are working in. Like I said, I've learned some things presenting about humor to the many people I've presented to. I've presented to over 2,000 therapists now. Many therapists share about the use of swearing in session and how that can be a useful tool of humor. But when I presented to them to the Hawaii Psychological Association, I learned that the native indigenous Hawaiian language has no swear words, that culture operates from a perspective of respect. So there's no cursing or swearing within that language. And I think that's an important thing to know if you're going into therapy with a person who comes from that culture. I like to use case examples in my presenting from other therapists that I talk to about this. One of those case examples includes a therapist swearing to a teenager they met as a way to sort of connect, to open this teenager up. But what I learned presenting to some therapists in Australia is that an adult swearing towards a child in Australia can actually be a criminal charge. So again, the point that culture and humor are really important things to look at. To give you an example of the case examples I like to use, here's a cultural example called Barn Clothes. This is from Trevor Swoverland, who's an LICSW in Duluth. Psychotherapist at MAP Behavioral Health and has been a clinical supervisor there and at Ascend, and continues to provide supervision to new therapists. He's a hobby farmer. Recently, we tried to get together, but he had to butcher a hog that day, which I thought was quite humorous. So we couldn't. Trevor shares this example of working with an African-American client from Chicago who moved up to Duluth, and out on the streets feels very awkward if they sort of dress the way that they would back in Chicago. They feel like if they don't put on the right mask for Duluth, Minnesota, they feel called out. And Trevor normalized this experience by discussing the idea of him going to Chicago in his barn clothes, right? So Trevor, the psychotherapist, the Caucasian male psychotherapist down in Chicago intercity, right? Overalls, barn boots, probably, John Deere hat and etc., right? So use this example to normalize. Trevor and the client, of course, laughed at this. It was really a shocking idea. They really connected around this idea, and it helped normalize the experience the client was having, and was, I think, very funny. Depending on how long I present for, I like to include a case example every few minutes. When I have the time and the space, I like to be able to pull case examples out of the audience, if appropriate and if possible. So I think we're all teaching each other about this topic as we go. Other topics I sometimes include in my presentations, review of the research on humor, some ethical considerations, primary uses of humor as intervention in session, humor and how it fits in basic social work theories like person and environment and use of power, humor and how it fits in psychotherapeutic theoretical perspectives like CBT, DBT, EMDR, and others that I'm trained in, humor's role in self-care for the provider, the history of humor in the human species and the other great apes, classifying different types of humor to better understand how humor might fit in session. I can look at polyvagal theory and humor in the body. And of course, like I said, giving more and more of those case examples as we go to really illustrate how this works. And then I wrap this up today just giving a list of citations from several of my past presentations. I think when we're talking humor in therapy, it can be easy to go sort of all sparkle and no evidence, if that makes sense. I want to make it clear that I'm like doing research, really digging into how this fits within other evidence-based practices. So just a handful of slides illustrating some of the sources that I go to, both in my book and within the presentations that I do. These are not alphabetical. This is the one part of today that I just pulled from other presentation slideshows I have, but really wanted to give you all a chance to look at where my work comes from. So there we go. That's going to be it. I hope this has been useful. It's a pleasure to do it. Hope to talk to you soon. And I hope that you have a really excellent day. Thanks so much. Bye-bye.